Namaskar. You are watching Dr. KK Med Talks Fridays with Dr. Anita Kant, non-stop show 1050th episode. Let's have the headlines of the day. Global study reveals UTI prevalence in pregnant women is at the rate 23.9%. The oral Euroimmune vaccine may help prevent chronic UTIs according to initial results from a long-term study. The drug Pivya, that is pivmesilinam, is approved by FDA to treat women over 18 with uncomplicated UTIs which are contained in the bladder and haven't spread to the kidney. Officials say the antibiotic gepotidacin is performing so well in trials that it may be available sooner than expected for treatment of UTIs. New medical evidence shows that cranberry products can prevent urinary tract infections. Let's go to the topic of the day. Today, we will be talking about UTI management and prevention in pregnant women. And the speaker who is going to tell us all about this is Dr. Madhulatha Alexander. Professor Dr. Madhulatha Alexander is a distinguished expert in obstetrics and gynecology, holding an MBBS and MD in the field. As a dedicated professor at Osmania Medical College in Hyderabad, she is committed to advancing medical education and enhancing patient care. With extensive experience and a passion for women's health, Dr. Alexander plays a vital role in training the next generation of healthcare professionals while actively contributing to research and clinical practice. Her expertise and leadership continues to inspire both the students and colleagues in the medical community. Welcome, Dr. Alexander.
Yeah, thank you, Dr. Anita, for your warm welcome.
So,
Thank you.
thank you. So, shall we start? I have some
Yeah,
questions from the audience. So, what is UTI and why are pregnant women more prone to it?
yeah. UTI means urinary tract infection. Now, UTI in pregnancy is different from UTI in not in pregnancy, but the treatment is basically the same. Only thing we should remember is we're not only treating the mother, but also the unborn baby. So the drugs which we use should not be affecting the baby. Now, a little bit about UTI in pregnancy. UTI, what is it? It's infection of the urinary tract. Okay, usually what we are concerned about is what happens is that cystitis, the bladder gets infected usually, and the urethritis. That's a lower urinary tract infection. Well, if the infection goes higher, it goes to the pelviurethral when the kidney is involved. That is a more dangerous kind of infection, which needs immediate admission and parenteral antibiotics. Now, what happens is in the more common one, what we always see is the infection that is the lower down, because we as women are more susceptible to infection in the lower urinary tract. I think there are many factors. I think we'll be coming to it, but this is of concern because this can cause various problems in pregnancy, not only to the mother but also to the baby.
So, how
To the
exactly can affect the pregnancy? Is the next
yeah,
question.
yeah. Now, it can affect the pregnancy because if you have any infection anywhere, you can have preterm labor. That is, you deliver earlier than normal, or you have the baby that doesn't grow well. It's called IUGR, intrauterine growth retardation. Definitely, UTI has a connection to it. The other thing is, in people who are having infections, they have more incidence of PIH, that is BP in pregnancy, and also what the other problem is anemia. They also have anemia, so this should be corrected. There's another thing in pregnancy that comes called asymptomatic bacteriuria. That is, there will be no symptoms, but the urine culture will be coming positive. Now, if a normal person who's not pregnant has this asymptomatic bacteriuria, we do not correct it. But if a pregnant woman has it, we have to correct it because it causes all the negative parts. Another thing is, if this asymptomatic bacteria is not corrected, 25% of them will develop acute pyelonephritis, or I told you the more dangerous kind of infection.
Right. So, those who have a symptomatic UTI, what are the common symptoms during
Symptoms.
pregnancy?
Now, the symptoms in pregnancy are usually the symptoms which are also away from not in pregnancy. That is, they have frequency. They keep on passing urine, or they have a burning micturition. Burning, when they pass urine, they have a kind of discomfort or a burning sensation. Sometimes at the end of urination, also they have a kind of discomfort or pain. They may also have hematuria, that is, blood in the urine, or or as not only the infection may not be only in the bladder, but they also can have systemic symptoms like fever, chills, etc. The patient who has a higher urinary infection, that is the pyelonephritis, has a more toxic picture.
Okay. So, those who have UTI during pregnancy, but they are asymptomatic, the urine routine
Yeah,
may be showing pus
same.
cells. So, do we need to treat those also, or only culture positive women need treatment?
If a woman is having asymptomatic bacteria, that is, she is having infection, she has to be treated. And usually nowadays it's become mandatory. I work in a public sector in a government hospital. Even for us, as soon as the patient comes, we are doing urine culture. Although it's expensive, we are doing it because we know the impact of this infection on the pregnant mother. So if the urine culture is showing positive, we treat the mother with the appropriate antibiotic. We can't be using all antibiotics, only certain
Yes.
antibiotics, and they're very safe in pregnancy. Those only we use.
And is this UTI dangerous for the baby also?
Yes, dangerous for the baby in terms of the baby may not grow well. That's called IUGR. Or it may be born early. That's also a very dangerous thing because there are so many complications of babies being born early. So both these are very bad for the baby. So we try to avoid this and any other infection, we try to avoid by treating this asymptomatic bacteria in pregnancy. We are so careful that if the patient has it, we repeat the culture after treatment, see if it's negative. But sometimes they are not always correct. Or sometimes we have to give long-term antibiotics. But this we realize the importance. But all patients we don't give. We only give patients who need it.
And these treatment options are only tablets, or some injections can also be given?
Generally, the first line of treatment is tablets. Okay, oral antibiotics are usually given, and usually they clear up with oral antibiotics. But sometimes they don't. Then we have to admit the patient and give them antibiotics which are higher level. They're called second and third generation. We give them higher. We give them parental antibiotics, and unless we give it, they don't get treated. The treatment has to be eradicated. So sometimes we have to do it all the penance and all that very good antibiotics, but they are not first line. Only if they're not responding or indicated by the doctor, then only we give it.
Okay. And any general precautions like using
Mm.
clean public toilets and intake of water or
Water,
liquids
yes.
increase, does that help?
Yes. Generally, what happens is in pregnancy, we have the hormone called progesterone. It relaxes the smooth muscles. So our bladder doesn't empty as frequently as it is. So what every mother should do is drink at least 1.5 to 2 liters of water every day. And also at least in 2 to 3 hours, she must go and empty her bladder. Because whenever there is stasis or whenever there's urine in the bladder, it causes infection. So the mother must drink a lot of water. She must have frequent voiding. Also, perineal hygiene is very important because the main source of infection is from the anus. So the mother must always wash herself from front to back and not vice versa. Douches, etc., are not recommended nowadays. Also, use cotton cloths and also use plenty of water. As I said, all these simple precautions will definitely go a long way in preventing urinary infections.
This At this point, I want to ask you a common query. Usually nowadays in the urban population, they're using jets to clean themselves, and they tend to use the jets from the back because they think they are just cleaning the backside.
Backside,
So, does that
yeah.
lead to increase in UTIs?
See, I don't know whether any studies have been done, but it is not recommended. Always the jet should not be very forceful because it may be traumatic. And always the jet should be from front to back, not vice versa. Because we don't want the E. coli, which is the most common organism, which is there in the anus, to get inoculated anteriorly to the perineum. So it's not recommended. Also, soap is not needed. It is not needed to wash the perineum with soap when you pass motion.
Okay. A listener is asking, are antibiotics safe during pregnancy for UTI treatment?
Yes, not all antibiotics. There are certain antibiotics that are given. That is the cephalosporins, what the doctor will be telling you.
Mhm.
Sometimes they're single dose. Now, single dose are getting popular. They can be 3 days or 5, but generally we give antibiotics for about 5 to 7 days. Okay, and we only give the antibiotics at least B and C category. There are very categories of antibiotics. We do not give the D and X categories. We give the B and C. A category, I don't think any antibiotic exists. That is absolutely safe in pregnancy. But what we do is we give antibiotics, and generally patients respond to the lower antibiotics.
Yes. So, can this UTI in a pregnant woman, especially, lead to kidney infection?
Yes, if not treated, what happens is now the kidney is in the abdomen, okay? Below, all the urine collects through a ureter. It's a tube that connects the ureter to the bladder. Now, what happens in pregnancy is all the smooth muscles, as I told you, relaxes because of the hormones. So, what happens because the urine refluxes, it comes from the bladder into the ureter. This can ascend, it can go up, and it can cause something called a pyelonephritis. Pyelonephritis is a dangerous condition. The mother can become toxic. She can have respiratory distress, and she can have septic shock syndrome. These are very dangerous and can be life threatening. So, if a mother is giving us symptoms like that, we are very alert. We immediately involve a urologist, a nephrologist, and we don't allow, basically, we should not allow the infection to spread. We admit the patient, give her adequate hydration, give her the best antibiotic, and sometimes if you don't have the culture, we start with the parenteral antibiotic, and if the culture comes after 2 days, we give the appropriate antibiotic for the correct time.
Right. So, besides, increased hygiene and increasing the water intake or liquid intake, are there any other measures also which can help
Yes.
prevent UTIs during pregnancy?
Yes. Now, see, certain foods like caffeine and alcohol and all these high sugary syrups, they are supposed to irritate the bladder, and they will cause the pili. Most common organism is E. coli. It has the pili. It latches onto the bladder and it multiplies and it causes the infection there. So, all these food items should be avoided. Another thing that is gaining popularity is cranberry juice. Exactly how it happens is supposed to prevent these organisms from multiplying and attaching, but exact dose and how many times, usually is given twice per day, but it seems to help. But for how long and the exact dose is not needed, but it's supposed to help and giving good results. I suppose a lot of studies have to be done before we give it as a first line treatment for prevention of UTI in pregnancy.
Right. So, besides that, there are some other remedies, household remedies which can prevent UTIs during pregnancy.
Household remedies, I don't know, ma'am. Probably you have to help me out. But apart from this, I don't know. Could you help me out in this answer?
Well, in North India, there's something called fitkari. It makes the urine alkaline. So those who have
Oh,
burning in non-pregnant, at least they are told to soak it, the edible variety, they soak it and then drink that water. So instead of
okay.
taking alka-citrol and all these things, they can take that.
Okay. I didn't know that.
Okay.
Mm.
And how much water should a pregnant woman drink to prevent UTI?
What is recommended? At least 1.5 to 2 liters per day. So, what is recommended is the mother must at least fill the water and keep it, 2 bottles, and she must finish it off during the daytime. It is very important. Not only does she drink it, she also must at least go on voiding, because this what happens is if the urine stays in the bladder, there will be multiplication of the bacteria. And I told you, because the pregnancy hormones, there's a little less tone. So all this can contribute to the infection. Another thing is sometimes patients are more prone for infection. For example, diabetics. And pregnancy is also immunosuppressed. So already our immunity is decreased. Okay. Then also in pregnancy, we have something called glycosuria. That is, our urine has more sugar than what it's supposed to be having. All these contribute to more infections. There's something called sickle cell trait, hemoglobin S, where these patients also are more prone to UTI. So all these patients, Not only we must keep an eye on them, we must advise them and give them more frequent cultures than what is necessary.
Okay. And can sexual activity also cause UTI during pregnancy?
See, some patients who are more prone for getting UTI, those patients, sexual activity is, yes, it can contribute because the partner only can give the infection to the patient. So what is advised is, after sexual activity, please take 1 glass of water and try to void. This may help in controlling the infection. Also, we
Uh,
advise patients first 3 months and the last trimester do not have coitus, because
okay.
this can also not only cause UTI, it can also cause you to have rupture of membranes and early labor.
Right. Well, if there is a repeated UTI, do we tend to test the husband's urine culture also to know where the source is?
I mean, in my practice, we don't do it, ma'am. If repeated UTI, we just go on. Husbands, we hardly see in our practice. Okay,
Okay,
if
okay,
at all they have dragged, they have to come. Otherwise, we don't see them. But generally, what we do is we give them a long-term treatment.
okay.
Nitrofurantoin is what is commonly used. It is safe in pregnancies, but in the last trimester we avoid, because this may cause hemolysis in the baby. So we don't give that. The good antibiotic, we don't give it in the last trimester of pregnancy.
Right. And is it safe to self treat a UTI with over the counter medications during pregnancy?
I mean, I, as a doctor, the gynecologist, obstetrician, would not advise a woman if she's having UTI, definitely see your doctor, because she may be missing something vital. And all this long-term treatment, a culture, is necessary, because if your baby is born preterm or small birth weight, all these which could be treated have been missed. So if you're having UTI, as a doctor, I would advise my patient visit the doctor once. She may check out your blood sugars. She may check out other reasons why you may be having the UTI. Okay, I feel you should not be self-treating and self-medicating like if you're not pregnant.
And in women who are pregnant, do we routinely do urine tests for urine infection? And if so, then how many times during the pregnancy?
When a patient comes initially, a booking visit only, what we are doing is we are doing a urine culture, urine examination also. Okay. Now, if there's any abnormality only, we are repeating every trimester. That means every 3 months we are repeating it. But if a patient is high risk, if a patient has some reason, then we repeat it more frequently. But anytime a urine culture comes positive, we repeat it till it becomes negative. But sometimes, as I told you, the infection doesn't clear off, then we have to give long-term treatment.
And you said that UTI, if left untreated during pregnancy, can lead to problems in the mother and
Mother,
baby,
baby.
both.
Mm.
So the viewer wants to know if you could just sum up what all problems can happen to the mother and to the baby.
Yeah, mother, see, if now UTI is an infection, okay? So once you have an infection, you have problems with the mother. Directly, apart from the morbidity or the sickness the mother feels, the mother has more chances of getting BP. It's called PIH, which is a nightmare for all of us. UTI
Yes.
patients have more chances of getting increased blood pressure. And also, because of infection, it's like one vicious circle. The mother also becomes anemic. Anemia also the nightmare for us to be treating. So these two are the main problems in the mother. In the baby, we get a small preterm baby, and we also have a baby that doesn't grow well, which has its own problems, which is also which is treated by the thing. But one more thing I must tell you is, when the mother is having infection, this is not an indication for terminating the pregnancy. First, control the infection. Only then think of termination for whatever reason you're terminating her.
And can certain foods or drinks, like nowadays
Hmm.
children do tend to go for
Do drink.
colas and energy drinks, do they increase the risk of UTIs during pregnancy?
Yes, they do, because they irritate the bladder. And as I told you, the pili, or the projections on the E. coli, they latch on to the bladder, and they stay for longer, they multiply nicely, and they're a nice bacteria, there's a nice medium for them to multiply. So we should not be drinking all these things. Smoking also is not good. All these things contribute to more chances of UTI. And because, see, if you don't treat this patient, 25% of them are going to get pyelonephritis. That is the dangerous infection that is life threatening to the mother. That infection I told you it can cause septic shock. It's a very dangerous infection. So, to prevent all that, it is necessary for you to take proper antibiotics, proper care, proper hydration, and know at the back of your mind UTI is an important infection that has to be looked out for and checked every trimester. So much so, actually, in fact, even a urine culture, I'm not sure how much it costs, but it's quite expensive. But the government has
3 months.
recognized it is how important it is. Okay, so we are giving the UTI, we are giving the urine culture to every government patient when they come. What happened, ma'am? Hello? Yeah,
Ma'am, I think there
yeah,
is some
it's
network.
Arpita.
Yes, yes, ma'am. There is some network issue, I guess. Yeah.
What
Okay, yeah,
lifestyle
ma'am is coming
changes?
on.
Mhm. Yeah. So,
Yeah,
what lifestyle changes can help reduce the risk of UTIs in pregnant women?
yeah, lifestyle changes I what? That is, personally, I would say drink a lot of water, perineal hygiene, okay, and I suppose so treat the infection properly. Apart from lifestyle changes, is only drink a lot of water and
Mhm.
perineal hygiene, and also rule out. Supposing you're having a diabetic, or nowadays I feel India has become the diabetic capital. So all of us have to be very careful with our blood sugar because these people have more chances of getting UTI. So I suppose that's very important to take care of.
Are UTIs more common in certain stage of pregnancy or all throughout it can lead to problems, lead to UTI?
See, the asymptomatic bacteriuria is more common in the first trimester. Okay, first trimester it's there. It's about lesser percentage is there in the second and third trimester. But if you look at the pyelonephritis, it comes more in the later part. So throughout pregnancy, you are more of a chance of being exposed to it. But there is any person who's at risk. Anytime you can get UTI.
So, any takeaway message for our listeners?
Yeah, I would say the takeaway message is uh, check your if you're pregnant, get yourself booked early, get a urine culture at the first examination, and follow a healthy lifestyle. Drink a lot of water, empty your bladder. Many people don't like to go to the public toilet saying it's very dirty and all. But remember, emptying your bladder contributes a long way in preventing infection. Okay, and any problem, contact your doctor. No self medication, and follow your doctor's treatment correctly. Correct any other factor that can be corrected, go ahead and do it.
Right. Thank you so much, Professor Dr. Madhulatha Alexander, for joining us today. Could you show us the certificate, please?
Oh wow.
This is a small token of
Nice.
thanks from our side for you to come
Okay.
over and give so much of knowledge to our listeners. I'm getting so many other questions, but I think we will have another meeting on another day to answer all of them. Thank you so much.
Okay.
That will be
Yeah,
all for
thank you.
today.
Such a pleasure, doctor. Yeah, thank you.
Thank you.
Thank you.
Dr.
Bye.
KK Med Talks will return tomorrow at 7 p.m. with another edition of the show. Keep watching Dr. KK Med Talks. Namaskar.
Bye. Thank you.
Bye.